So this is going to be me telling my story about how I'm coming to learn about whether I have scleroderma, and more specifically diffuse scleroderma. So how did I learn I may have scleroderma? Well, I've had 2 blood tests come back. They were positive, and in those blood tests, one of them was specific for an antibody that may be related to diffuse scleroderma. If you know what diffuse scleroderma is, that's the one you don't want. Scleroderma has several types. It's different for every person. But when it comes to diffuse scleroderma, that usually means that there's going to be involvement not just of the skin. If you do have that, there could be involvement of the organs as well. That means it can affect gastrointestinal. It can affect your heart. It can affect your lungs, and so on. So the way I learned out or find out that may have had scleroderma was because a family member suspected I did after doing some research, after I ended up showing Raynaud's phenomenon. Now, if you have scleroderma, you may know what this is, and of course, Raynaud's phenomenon may occur by itself and doesn't mean you have scleroderma. Raynaud's phenomenon is where you have constriction of the blood vessels in the hand so that your fingers, your hands, or your arms, or all 3, can turn a different color when you're exposed to cold or a stressful situation. So let's say if I were to go out in the cold right now when it's snowing, it's super cold. I can go out there and my hands may turn blue, and it could be just the fingers, it could be down the length of the finger, it can include the palm, and it can go up to the arm. Now, when I get into a warmer environment and I start to heat up, it can be painful when the blood vessels start working a little better and I start to warm up. It can be very painful. In addition, with this issue, you can also have an issue where you end up having cuts or ulcers on the fingers because the finger's not healing very well. And so that's an issue, and it's like you got to take care of your fingers very well, protect them so that you don't get them infected. Aside from that, my family member also determined that I had a few other factors that I was seeing as independent and not related all in one piece. One of them was I felt like I had pain all over. And when I mean pain all over, I must feel like I had arthritis all over, like I was like 70 years old. I had swollen, tight fingers. As you can see from here, you can see my hands, they're swollen. Sometimes it can appear a little red. They are tight on the fingers. You can't actually grab any loose skin on the fingers, as you can see I'm doing right now. Alright? I also had a cough, but I also figured that may have been part of asthma. Not every person with scleroderma is going to have a cough, but it can happen. I've seen some videos with people telling their stories saying they had a cough for a while, but they didn't connect it to possible scleroderma. And it may be that I found out later that has nothing to do with the disease. It may be just the asthma. For me, another thing I had was I had a problem handling stuff. So sometimes when I was cutting like a pizza, I could drop the knife. I couldn't open a bottle of soda or of Gatorade really easily. It was really hard for me to do it, and I thought maybe something was wrong with my fingers. They're slippery, so I could use like a shirt or a towel, and it'd still be kind of hard for me to do. I'd have more traction, but it was still hard for me to open a bottle, and I would often refer to some sort of assistance from someone else so they could open it. Sometimes I would drop things more than usual. It happened so infrequently that I didn't think it was a problem, but it was there. There was an issue in my grip. So, in my case, I am now awaiting a referral to a specialist. It would be a rheumatologist locally. And from what I learned, rheumatologists, at least for the clinic that I'm hoping to visit, in that situation, apparently they will take about 2 weeks to determine from their border doctors. They will review the case files of the patients that have come through and are seeking a referral and determine if they want to take them on as a patient. So I didn't know that could happen. From what I knew, a referral to a specialist meant that you would just go to the specialist, you would ask for an appointment, you'd get it set up, and then you follow through. This one they can deny you, and I had to be ready for that. I don't know why they would deny me at this point, but I have read online there are stories where you can be denied for whatever reason they determine. And I have a few other clinics that I can look at locally and in out of state where I'm prepared just in case this doesn't go through. That's pretty much what I know right now. Some of the research that I've done personally, from what I know, there is no, or from what I've seen, there's no cure for scleroderma. And it does supposedly, dependent on the one you have, or on the category you have, the type, it does restrict movement. And it can start to restrict some issues with the organs. It's not a good picture to look at. It can get you very worried if you continue to look at Google. In fact, my doctor, once I told them that I did do some research about the disease, they recommended that I did not do that. I see why now. It can get you down. Really, it can, knowing the full picture of what can happen can really get you down, but I feel like I'm more educated. I've learned about different clinics around the country that are available. I've learned about different clinical trials that are available both here in the United States and internationally from my research. And right now I'm hoping that when I do see, if I end up seeing the specialist, the rheumatologist at this clinic, that they will determine that this is not going to be diffuse scleroderma. If it is, I'm going to have to prepare for that as well. I don't see any information about how long the longevity is for someone who has diffuse scleroderma, but several factors can determine a prognosis, and they can include I guess a score for the body when it comes to the involvement of the skin and other factors such as race, apparently. From what I've seen, there are several factors that make me wonder what the longevity for my situation would be. But if I continue to focus on that, I know that's negative. So right now I've decided to just do this video, and if anyone else is in a similar situation like myself, they can learn about at least one person's story about what's going on as they learn whether they have one, scleroderma, and two, if it's diffuse. So I'll continue putting out more videos as the process goes on and let you know what's going on in my story.